issue with my good old doc. Trust issue where my friends all talk.
Okay, next up we have Dr. Mariela Glandt, who's an endocrinologist trained at Harvard and Columbia. She founded a clinic to treat diabetes and has been now doing this work for 20 years. She's also now working in the South Bronx, which is the poorest part of New York City. And her work has been spectacular. She's going to come up also with a patient of hers, Ajalah Efem, who's going to talk about her experience. So let's welcome them.
All right. Hi, everybody. What a party. All right. So, ladies and gentlemen, fellow advocates for health, today I stand before you with a critical message that many in the medical field have overlooked or even ignored. And it's my duty as a doctor to set this record straight. The dietary guidelines, which we've been held to for many years, are actually wrong. They've contributed to a public health crisis that we can no longer accept. I'm an endocrinologist. I've been treating diabetes for more than 20 years. When I started medical school, diabetes was there. It was common, but now it has skyrocketed. Today, 1 in 10 people have diabetes, diagnosed diabetes. And this is not just a number. It's a wake-up call. It's a tragedy affecting countless lives and families and communities across the nation. But here's the good news. Diabetes can be reversed. And this reversal starts with what we put in our plates. For too long, we've inundated our bodies with an excess of sugar and carbohydrates, more than we can handle. Our blood sugar levels rise, and then in many, diabetes sets in. But those blood sugar levels are actually signaling something. They're saying that you've stored too much. You've stored too much sugar. You're now intolerant to carbohydrates and sugars. So what do? Well, we must simply just eliminate them. We must eliminate these substances from our diet. And you must ask, well, how can I eliminate, how can I stop eating carbohydrates? Can I do that? And the answer is yes, we don't need carbohydrates. We don't need to eat carbohydrates. Let me rephrase that. Our livers are built to produce the right amount of glucose that we need. We need fats. We must eat fats, and we must eat proteins. But we absolutely do not need to eat sugars. So why keep consuming what's making us suffer? Now, sugar comes in many forms. It can be sweet, like fruit or candy, but it also hides in bread, in pasta, in rice. And many people are afraid, and they think, well, I'm going to be starving if I stop this pasta and rice. But no, actually, the answer is exactly the opposite. I can tell you that after treating 4,000 patients, when we stop these carbohydrates, people's hunger goes away, the cravings go away, just within a few days many times. When we eat this way, we begin to mend our metabolism. We feel energized, and we break free from this burden of fatigue. And let's not forget the life-saving benefits. By taking charge of our diets, we can dodge the heart attacks, the amputations, the kidney disease, the blindness, cancer, and depression that's often linked to diabetes. There is no reason for us to be sick. It starts at the top with our faulty government guidelines. It is time for the government to look at the complete evidence so that the advice they give is consistent with the science. These guidelines have far-reaching effects, influencing every part of our society. As they stand, they will continue to make us sick, and they will continue to make us think that diabetes is a progressive and chronic disease. But it is not. It is preventable and reversible. And while we wait for our government to act, we must empower ourselves to make some informed choices. We are not waiting. I work in the South Bronx, as Nina said, and have seen over and over people with very limited means reverse their diabetes by changing the way they eat. And here, I want to introduce my very dear patient, Ajalah Efem, to come tell her story.
Hello, my name is Ajalah Efem, and I'm from the South Bronx, and I do want to share my story with you. A few years ago, I thought I was taking charge of my health. I followed all the latest health advice. I switched out animal fat for vegetable oil. I stopped drinking soda in favor of fruit juice and replaced my white rice with brown. I always followed the food pyramid and made sure each food group was represented on my plate. Most of you probably tried those things as well, but it didn't work for me, and probably didn't work for you either. After making all these healthy diet changes, I was surprised when I started to feel sick. It seemed like the healthier I tried to be, the sicker I became. I was tired all the time. I was extremely thirsty and foaming from my mouth, and I couldn't be more than 5 minutes away from a restroom. My doctor diagnosed me with type 2 diabetes. She then hit me with the worst sentence I ever heard in my life. There is no cure, and you can only learn to manage your symptoms. I was devastated by this, but I was determined to control the symptoms of the disease. Unfortunately, it wasn't that easy. My doctor's first step was to prescribe about 5 different medications. Next, we added a nutritionist who told me to eat overnight oats and apples with peanut butter. Then a specialist showed me how to use insulin to maintain my blood sugar. Finally, I was referred to a bariatric surgeon to discuss surgery, but that was too extreme for me. I did, however, make sure I took my medications every single day. But as time passed, my symptoms got worse. My eyes began to fail. I was having massive migraines. But the worst part was my mind. Everything was cloudy, and I was constantly forgetful. The 5 medications I was taking became more than 15 medications. Still, my health declined. I had to use a nebulizer multiple times a day for my worsening asthma. Climbing up a flight of stairs was like climbing the Himalayas. I couldn't walk to the end of the street due to the swelling in my feet. I needed a cane now. I could no longer sleep due to the excruciating nerve pain in my legs. And in an attempt to help me, my doctors increased the doses of all my medications. Now I was at the highest possible dose of every medication. Yet my blood sugar kept rising. My hope for managing the disease turned to despair. Despair became depression. I no longer left the house. No, I no longer left my bed. I essentially gave up. Sorry. In my depression, I beat myself up. Thank you. It's your fault, I told myself, because you couldn't do what the doctors asked you to do. Sorry. I couldn't lose the weight. I stayed at 296 pounds. It's your fault, I told myself, because I can't exercise. I used to play tennis. I dance. How did I become like this? It's your fault because you can no longer be a good role model to your children. My kids became ill also. They developed all my ailments. I couldn't help but feel like I was letting everybody down. My doctors, who had used up all their knowledge and resources, helping me as best as they could, decided that I should see a specialist. I had to wait 8 lonely and scary months. My blood sugars would rise from 300 to 800 and then drop back down to 30. I took insulin 3 to 5 times a day. But in November of 2023, I hobbled, limping on the office with my cane into the office of Dr. Mariela Glandt. After hearing my story, the first thing she said to me was, "It's not your fault, and I can help you." I knew then that she was different. On the very first visit, she took all of my medications away, including the insulin that I thought I needed to survive. What she did next was equally surprising. She produced a food chart different from anything I had ever seen. It was essentially a list of food that I would be eating. She called it my new medicine. Her warm words, positive encouragement, and optimism that day was the first glimpse of hope in my soul that I had in a long time. I was ready and willing to take a chance on her. My family members, on the other hand, were very concerned. They told me on a daily basis that I was doing a very foolish thing. Even my own primary care doctors cautioned me about following the advice of Dr. Glandt. But as it turns out, they were wrong because I got better. I got better, and it didn't take years. It was a mere few days before I was up out of bed. It was a few short weeks until I ditched the cane, and a couple of swift months before I lost over 40 pounds. Changing the way I ate changed my life. I now have a life with a bright future ahead of me, a long future ahead of me. I am playing and dancing again. I am able to pursue my dreams of becoming an entrepreneur. I actually enjoy taking my new medicine because it's just simply delicious food. It's crazy how my love of food got me into this situation, and it's the love of food that is going to get me out. I will say that this journey to health has shown me that getting healthy depends on getting the right advice. Because of Mariela, I got it. But I was one of the lucky ones. I believe that all Americans deserve to know how to get healthy like I did. Thank you. Thank you.